Cavitating lesions. We have two views of a chest X-ray. This X-ray shows a cavitating lesion in right upper lobe, which is located more towards the lateral side of right lung and posteriorly on lateral view. It is not clear that whether the X-ray is a PA view or an AP view, but it is very clear that the X-ray was taken in erect position. Also, there is no left or right marker on it, so we are using hard shadow to assume that this is the left side and this is the right side. Again, assuming patient does not have dextrocardia, in which people have heart on their right hand side. A cavity appears on a chest X-ray as an opaque shadow, a circular opaque shadow with a lucent, radiolucent, means black shadow in it. This lesion is well defined, means it is clearly showing its boundaries. The cavity is also thick walled, and this is the thickness of the wall of the cavity here. The radiolucent means black shadow is produced by air which is trapped within the cavity. The fine straight line here and here is air fluid level, means the cavity has two things in it. One is fluid, the other one is gas or air. Now because the patient is standing, fluid falls down and air rises up, creating this straight line which we all know is known as air fluid level, and it is because of this air fluid level that you can say the patient is in a standing position. If this X-ray was taken in supine position, you will still see a radio opaque circular shadow with a radiolucent shadow within it. The only thing that you won't see would be this straight line, means the air fluid level would not be visible. The cavity is big enough to produce a mass effect and is pushing adjacent lung towards the mediastinum here. Both claustrophrenic angles, right claustrophrenic angle and left claustrophrenic angles, are clear. It means there is no pleural effusion or atelectasis. Both hemidiaphragms are clearly visible here and here. You can see right hemidiaphragm here as it continues anteriorly. Left hemidiaphragm does not continue anteriorly because of the hard shadow, and that's how we can tell this is left hemidiaphragm and this is right hemidiaphragm on the lateral view. You can also see air in splenic flexure of colon here under left diaphragm. This patient is either rotated towards the left hand side or has some degree of scoliosis. However, to comment on rest of the lung fields, a radiologist would need to see this X-ray in better resolution, actually in front of them. Cavitating lesions are usually caused by bronchial carcinoma, tuberculosis, lung abscesses, pulmonary infarction, vaginous granulomatosis, fungal infections, and in some pneumonias, especially caused by Staphylococcus aureus and Klebsiella pneumoniae. This short video is prepared for www.academyofprofessionals.com. The reference, just one reference, and acknowledgement www.redrounds.com. Thank you very much to redrounds.com for letting me use their X-rays. Thank you very much.